NCSBN RN 800 Questions and Answers Newest Full Exam Prep. Question 1. A client has an intertrochanteric fracture of the femur. How is skeletal traction applied? Option A. Inserting pins to provide steady pull. Option B. A suspending leg in a sling. Option C. Intermittent pull on the pelvis. Option D. Weights at both ends of the bed. The correct answer is option A. Inserting pins to provide steady pull. Skeletal traction uses pins or wires directly into the bone to provide continuous longitudinal pull. Question 2. What finding at a pin site indicates normal wound healing? Option A. Exudate. Option B. Crust. Option C. Edema. Option D. Erythema. The correct answer is option B. Crust. Crust is a normal part of the healing process and should not be removed from around the pin site. Question 3. What diagnostic study best confirms the location of an obstructing ureteral stone? Option A. Cystoscopy. Option B. Kidneys, ureter and bladder X-ray. Option C. Intravenous pyelogram. Option D. Ureteral lithotomy. The correct answer is option C. Intravenous pyelogram. Intravenous pyelogram visualizes the kidneys and ureters to locate the stone and assess obstruction. Question 4. Where is pain felt when a stone obstructs the upper ureter? Option A. Urethra. Option B. Urinary frequency area. Option C. Flank and abdomen. Option D. Lower back. The correct answer is option C. Flank and abdomen. Stones in the renal pelvis or upper ureter cause severe flank and abdominal pain. Question 5. A client with gout is most likely to form which type of stone? Option A is struvite. Option B. Staghorn. Option C. Uric acid. Option D. Calcium. The correct answer is option C. Uric acid. Gout is a metabolic disorder that leads to the formation of uric acid renal stones. Question 6. Which of the following is a gram-positive bacterial pneumonia? Option A. Klebsiella pneumonia. Option B. Pneumococcal pneumonia. Option C. Legionella pneumophila. Option D. Escherichia coli. The correct answer is option B. Pneumococcal pneumonia. Pneumococcal pneumonia is caused by the gram-positive bacterium Streptococcus pneumoniae. Question 7. What color sputum is expected in pneumococcal pneumonia? Option A. Bright red. Option B. Rust-colored. Option C. Green. Option D. Pink-tinged. The correct answer is option B. Rust-colored. Pneumococcal pneumonia typically produces green or rust-colored sputum from the infection. Question 8. Why is a client with pneumonia often irritable and restless? Option A. Prolonged bed rest. Option B. Positioning. Option C. Cerebral hypoxia. Option D. Intravenous fluids. The correct answer is option C. Cerebral hypoxia. Restlessness and irritability in pneumonia are often early signs of cerebral hypoxia due to poor gas exchange. Question 9. A client with asthma stops wheezing during an assessment. What is the priority action? Option A. Position client supine. Option B. Draw arterial blood gases. Option C. Start oxygen at 4 liters per minute. Option D. Establish a patent airway. The correct answer is option D. Establish a patent airway. Sudden cessation of wheezing indicates complete airway obstruction and is a medical emergency. Question 10. What is the correct term for stones in the common bile duct? Option A. Cholelithiasis. Option B. Nephrolithiasis. Option C. Cholecystolithiasis. Option D. Cholecystitis. The correct answer is option C. Cholecystolithiasis. Cholecystolithiasis refers to the presence of stones specifically in the common bile duct. Question 11. What is the positive sign of acute cholecystitis during deep palpation of the right upper quadrant? Option A. Cullen sign. Option B. Rebound tenderness. Option C. Murphy sign. Option D. Turner sign. The correct answer is option C. Murphy sign. Murphy's sign is a sudden gasp when the inflamed gallbladder is palpated during a deep breath. Question 12. What is the expected drainage for AT tube in the first 24 hours? Option A, 50 to 100 milliliters. Option B, 200 to 300 milliliters. Option C, 300 to 500 milliliters. Option D, 1000 to 1200 milliliters. The correct answer is option C, 300 to 500 milliliters. 300 to 500 milliliters is normal for AT tube in the first 24 hours after surgery. Question 13. Which stool finding is typical for a client with biliary obstruction? Option A, clay or gray colored. Option B, watery and loose. Option C, bright red streaked. Option D, black. The correct answer is option A, clay or gray colored. Bile blockage prevents bilirubin from entering the intestine, turning stools gray or clay colored. Question 14. When is it appropriate to begin oral feedings after bowel obstruction surgery? Option A, when no wound infection is noted. Option B, when able to eat a full meal. Option C, when bowel sounds return. Option D, when blood pressure is baseline. The correct answer is option C, when bowel sounds return. Clear liquids in food are introduced only after the return of bowel sounds confirms peristalsis. Question 15. How is a nasogastric tube measured for insertion? Option A, lip to shoulder to sternum. Option B, nose to lip to umbilicus. Option C, nose to ear to xiphoid process. Option D, tip of tube to first mark. The correct answer is option C, nose to ear to xiphoid process. The nose to ear to xiphoid process measurement provides an accurate length for gastric placement. Question 16. When is the best time to irrigate a colostomy? Option A, after meals. Option B, before meals. Option C, every 2 hours. Option D, at bedtime. The correct answer is option A, after meals. Irrigating after meals utilizes the gastrocolic reflex and peristalsis for easier evacuation. Question 17. Which food causes constipation in a colostomy client? Option A, fried chicken. Option B, eggs. Option C, tapioca. Option D, cabbage. The correct answer is option C, tapioca. Tapioca and rice are known to cause constipation in clients with intestinal ostomies. Question 18. What is the drying time for a plaster of Paris cast? Option A, 30 minutes. Option B, 14 hours. Option C, 12 to 24 hours. Option D, 24 to 72 hours. The correct answer is option D, 24 to 72 hours. Plaster of Paris casts are heavy and require 24 to 72 hours to dry completely. Question 19. What is a transurethral resection of the prostate? Option A, lower abdominal incision. Option B, resectoscope via penile urethra. Option C, perineal incision. Option D, horizontal incision bypassing bladder. The correct answer is option B, resectoscope via penile urethra. The transurethral approach involves inserting instruments through the urethra to remove prostatic tissue. Question 20. A client becomes confused and disoriented 1 hour after a prostatectomy. What is the most likely cause? Option A, hypovolemic shock. Option B, hypokalemia. Option C, hypernatremia. Option D, hyponatremia. The correct answer is option D, hyponatremia. Hyponatremia is a common complication of prostate surgery due to absorption of irrigation fluid. Question 21. What is the initial nursing action for a blocked Foley catheter after a prostatectomy? Option A, call physician. Option B, irrigate the Foley catheter. Option C, change the Foley catheter. Option D, administer narcotic analgesic. The correct answer is option B, irrigate the Foley catheter. Manual irrigation is the priority to dislodge blood clots and restore drainage. Question 22. What is appropriate advice for a client recovering from prostate surgery? Option A, a resume sex in 2 weeks. Option B, the experience of impotence is common. Option C, a surgery does not usually cause impotence. Option D, ask the doctor before sexual activity. The correct answer is option C. Surgery does not usually cause impotence. Most men remain potent after prostate surgery, although retrograde ejaculation may occur. Question 23. What medication is prescribed to treat hematuria following a prostatectomy? Option A, acetaminophen. Option B, meperidine. Option C, promethazine. Option D, aminocaproic acid. The correct answer is option D, aminocaproic acid. Aminocaproic acid is an antifibrinolytic agent specifically prescribed to reduce postoperative hematuria. Question 24. How should a client be taught to perform diaphragmatic breathing? Option A, inhale through nose, exhale through mouth. Option B, purse lips and take quick breaths. Option C, large gulp of air through mouth. Option D, deep inhalation and forced exhalation. The correct answer is option A, inhale through nose, exhale through mouth. Slow deep inhalation followed by slow exhalation facilitates full lung expansion and secretion removal. Question 25. What is the assessment finding for a client with placenta previa? Option A, a rigid board-like abdomen. Option B, uterine atony. Option C, soft relaxed abdomen. Option D, hypertonicity. The correct answer is option C, soft relaxed abdomen. Placenta previa is characterized by painless bleeding with a soft and relaxed uterus. Question 26. What is the priority nursing diagnosis for a client admitted with active bleeding from placenta previa? Option A, decreased cardiac output. Option B, fluid volume excess. Option C, anxiety. Option D, altered parenting. The correct answer is option A, decreased cardiac output. Excessive bleeding leads to hypovolemia, making decreased cardiac output the priority diagnosis. Question 27. What test determines fetal lung maturity? Option A, dinitrophenylhydrazine. Option B, metachromatic stain. Option C, a phenylalanine test. Option D, lecithin sphingomyelin ratio. The correct answer is option D, lecithin sphingomyelin ratio. An L/S ratio of 2:1 is the clinical standard for determining fetal lung maturity. Question 28. What is the priority nursing intervention for a client with placenta previa admitted for cesarean section? Option A, shave abdomen. Option B, determine fetal heart tones. Option C, start for infusion. Option D, insert indwelling catheter. The correct answer is option B, determine fetal heart tones. Fetal heart tones assess the immediate status of the fetus, which is the highest priority. Question 29. What are the initial symptoms of shock in a postpartum client? Option A, elevation in blood pressure. Option B, decreased systolic pressure and anuria. Option C, rapid pulse and cool moist skin. Option D, absence of urinary output. The correct answer is option C, rapid pulse and cool moist skin. Early signs of shock include rapid pulse and cool moist skin as the body compensates for blood loss. Question 30. What is the priority assessment for a client 1 hour postpartum? Option A, labor length. Option B, type of episiotomy. Option C, amount of fore fluid. Option D, character of the fundus. The correct answer is option D, character of the fundus. A boggy fundus is the primary indicator of postpartum hemorrhage requiring immediate assessment. Question 31. What is the nursing action for a boggy fundus postpartum? Option A, call physician. Option B, assess vital signs. Option C, administer oxytocic drug. Option D, massage the fundus. The correct answer is option D, massage the fundus. Fundal massage is the first-line intervention to stimulate uterine contraction and prevent hemorrhage. Question 32. What is the lochia classification for a dark red discharge 3 days postpartum? Option A, rubra. Option B, rosa. Option C, serosa. Option D, alba. The correct answer is option A, rubra. Lochia rubra occurs from delivery through the third day and is dark red in color. Question 33. In fetal circulation, the foramen ovale bypasses what? Option A, left ventricle. Option B, pulmonary system. Option C, liver. Option D, superior vena cava. The correct answer is option B, pulmonary system. The foramen ovale shunts blood from the right to the left atrium, effectively bypassing the lungs. Question 34. What is the most important nursing action when giving a blood transfusion? Option A, start 18-gauge 4. Option B, verify consent. Option C, administer blood product to correct client. Option D, transfuse within 2 hours. The correct answer is option C, administer blood product to correct client. Verifying that the correct blood product is given to the correct client is the primary safety action. Question 35. What must the nurse do prior to starting a blood transfusion? Option A, take baseline vital signs. Option B, hang ringer lactate. Option C, use microdrip tubing. Option D, verify client and blood with another nurse. The correct answer is option A, take baseline vital signs. Baseline vital signs are critical to detect any adverse transfusion reaction early. Question 36. Which symptoms indicate an allergic transfusion reaction? Option A, fever and chills. Option B, chest pain and hypotension. Option C, dyspnea and cough. Option D, urticaria and wheezing. The correct answer is option D, urticaria and wheezing. Allergic reactions manifest as hives, itching, wheezing, and anxiety during or after transfusion. Question 37. What diagnostic findings are expected in a child with coarctation of the aorta? Option A, third heart sound. Option B, diastolic murmur. Option C, pulse pressure difference in extremities. Option D, absent femoral pulses. The correct answer is option D, absent femoral pulses. Diminished or absent femoral and pedal pulses are hallmark signs of coarctation of the aorta. Question 38. What are characteristic signs of tetralogy of Fallot? Option A, decreased pulmonary flow. Option B, increased pulmonary flow. Option C, left to right shunting. Option D, parallel circulation. The correct answer is option A, decreased pulmonary flow. Tetralogy of Fallot includes pulmonary stenosis resulting in decreased pulmonary blood flow and right to left shunting. Question 39. How should the nurse prepare a toddler for cardiac catheterization? Option A, use pictures. Option B, use simple words just before. Option C, ask parents to explain. Option D, ask parents to leave. The correct answer is option B, use simple words just before. Simple explanations shortly before the procedure are best for a toddler's short attention span. Question 40. What are the post-procedure instructions after cardiac catheterization? Option A, notify if bruise develops. Option B, use sponge baths. Option C, take aspirin for pain. Option D, keep insertion site open to air. The correct answer is option D, keep insertion site open to air. The insertion site should be kept clean, dry, and open to air after the procedure. Question 41. What is the nursing approach for parents of a child with a congenital heart defect? Option A, tell child nothing. Option B, assist parents through grieving process. Option C, identify anger as destructive. Option D, expect grief to resolve after surgery. The correct answer is option B, assist parents through grieving process. Parents mourn the loss of the expected healthy child and require support during the grieving process. Question 42. What should parents be taught regarding digoxin? Option A, or repeat dose if infant vomits. Option B, mix with formula. Option C, notify physician if infant vomits 2 consecutive doses. Option D, change dose timing if skipped. The correct answer is option C, notify physician if infant vomits 2 consecutive doses. Vomiting, listlessness, and anorexia are signs of toxicity and require physician notification. Question 43. What is the most likely crisis in a child with sickle cell anemia and abdominal tenderness? Option A, a plastic crisis. Option B, a vaso-occlusive crisis. Option C, dactylitis. Option D, sequestration crisis. The correct answer is option D, sequestration crisis. Sequestration crisis involves blood pooling in the spleen causing tenderness and signs of hypovolemic shock. Question 44. What is the focus of nursing intervention during sickle cell crisis? Option A, hydration. Option B, pain relief. Option C, prevent infection. Option D, oxygen therapy. The correct answer is option A, hydration. Hydration is the priority to reduce blood viscosity and slow the sickling process. Question 45. What is the most effective way to communicate with a schizophrenic client experiencing voices? Option A, encourage discussion of voices. Option B, direct attention to the here and now. Option C, exhibit interest in voices. Option D, administer PRN medication. The correct answer is option B, direct attention to the here and now. The nurse should focus on reality rather than the content of hallucinations.